The CDC show booster doses are needed and effective against the Omicron variant. The CDC released results from 3 large studies of millions of cases. One study showed the booster is 90% effective at preventing people from being admitted to hospitals. After 6 months, the 2-dose series is only 57% effective. Omicron now accounts for more than 99% of U.S. COVID cases.
A lot of those who are testing positive are vaccinated but not boosted.
WAY 31's Megan Reyna spoke with health experts about when it's best to get the booster shot after a breakthrough case.
According to the CDC and Alabama Department of Public Health, you can get boosted after infection almost right away.
Once you finish your isolation and you feel better, you're over your acute symptoms, you can get the booster as soon as you feel better, essentially.
But Dr. Ali Hassoun, an infectious disease expert with Huntsville Hospital, has a different recommendation.
Initially said we probably should wait about 3 months, but from the data we have, probably 6 to 8 weeks after the infection would be okay to go ahead and do the shot.
He says this will prevent people from having side effects to the vaccine.
And you might have a little bit of more like the fever and the ache associated, the systemic symptom that associated with a shot. And that's why we really been telling our patient you can wait a little bit longer.
But what if you received an antibody infusion? Dr. Wes Stubblefield says wait 90 days.
And that's because the antibodies are in your blood and it's going to potentially interact with that vaccine.
Many people may assume they don't need the booster at all because of their newly formed natural antibodies. But Dr. Stubblefield warns those won't last forever.
Know from other circulating coronaviruses that are not COVID-19 is that you only get a short-lived immunity and then it's pretty much gone. So you can continue to get this over and over and over again.
And while the recommendations may vary from doctor to doctor, both of these physicians agree the booster is an important tool in the fight against COVID.
We know that the vaccine works better in people who have had the disease beforehand. That's where they saw the highest antibody levels at all.
It might be if you're vaccinated, you get mild infection, but you will avoid major complication.
Megan Reyna, WAY 31 News.
According to ADPH, fewer than 30% of those eligible for a booster in our state have received one.